The impact of the natural disasters in Japan will be felt for years. Tens of thousands of people dead or missing. Hundreds of thousands of people have lost every single thing that they've owned. Add in the hundreds of aftershocks even going on this morning, rolling blackouts, shortages of water, food and gas, and now the threat of nuclear contamination. It's too much to even imagine. So how does a country heal? Well, for some insight into the psychological impact of this disaster, we are joined in studio by Dr. Katy Kamkar. She's a clinical psychologist at the Center for Addiction and Mental Health in Toronto. Good to talk to you.
Thank you.
I don't even know where to begin. I mean, how does somebody who has gone through all of this, how do they deal?
I know they are really going through very significant stressors, upsetting events daily, if not even minute by minute. We know that during natural disasters, earthquakes and tsunamis represent a significant risk factor for the mental health of survivors. And of course, the psychological distress associated with those natural disasters is typically exacerbated by all the significant stressors and the losses that people undergo following those events. So in this case, we know of all the devastations and destructions, all the losses, and now we hear of, significant aftershocks and concerns in regards to the nuclear plants and radiations, the short-term effects, the long-term effects. So it's like daily significant stressors that they have to cope with.
It's amazing how it manifests itself. I was just reading that in Benghazi, Libya, when the shelling began, in that time afterwards, premature births went up 4 times.
Yes.
The stress has a physical effect on your body.
Physical effect, which then translates into mental health effects, which then again, it impacts our physical health. They're all intertwined. Absolutely.
So how do your colleagues help them over there?
There are various phases that people go through. The first one is really the impact phase. So the survivors of the traumatic events try to protect their lives and the lives of others. Yeah. And then after that is the post-disaster phase. So all the survivors might want to withdraw from the impact of the traumatic event. They might also go through various emotions. So shock, anger, sadness, feeling helpless. So feeling totally powerless or feeling hopeless, panic attacks. And after that is the recovery phase. So people move towards adjustment. But again, the adjustment very much depends on all the stressors or, the losses and the injuries that people had to go through. And it's really within the 4th phase that we can talk about post-traumatic stress disorder. So this is when people experience ongoing distressing thoughts or images or bad dreams. They also have arousal symptoms. So being always hypervigilant or on guard, concentration problems, sleep problems. So right now, because again, they're living through the trauma almost every day, minute by minute, and all the significant concern, it is really within the impact phase. So, there are survivors, but at the same time, people are trying to protect their lives, the life of others. So very much here, they are within the trauma.
It's still very much within the trauma. I understand. Culturally, tell me, there are obviously differences here. Japan is a different culture and deals with things, differently than perhaps we do here in Canada or in the United States. They have a much stronger sense of community, of relationships with family and with the community at large.
Yes.
And very different ideas of shame and pride.
Which very much represents a protective factor, especially during those traumatic and devastating events. We know that in this case, because again, they're all within the impact phase, community self-help groups, seeking social support is very important. Any, again, cultural practices, spiritual practices. But again, as long as they are together, trying to share one another's concerns and they try to seek support, problem solve together, that can very much be help towards adjustment later on.
Okay. Katy Kamkar, thank you very much.